This menopause transition can go on for almost 10 years, and that is a really critical window to target women and help reduce their cardiovascular risk by approaching all of the systems in the body and making sure that we have a multidisciplinary group taking care of these women.
Hello everyone, my name is Akshat Banga. I'm one of the social media ambassadors for ASPC, and I'm here with two female cardiologists who are revolutionizing preventive cardiology, specifically the women heart health aspect of it. It's great to meet you and talk to you about how you guys are changing the world of women heart health.
Well, thank you for having us, and thank you for that kind introduction. I think women's heart health for a lot of time has been ignored, but I do think that in the last few decades we've been talking about it more, doing more research, and hopefully finding answers. So we're really excited to start our new working group on women's cardiovascular health, because in prevention, I think that's where it's going to start.
Thank you so much for that incredibly kind introduction. I'm humbled to be standing next to Dr. Gulati and meeting you as well. To echo what Dr. Gulati said, women's cardiovascular health is incredibly important. We know that. It's the leading cause of death of women globally. And there are so many risk enhancers that are sex specific that we tend to fail to acknowledge as clinicians that we need to really focus on women's heart health. So one of the things we really like to talk about right now is the risk of gestational disorders during pregnancy and asking patients their history. I think that's really important. So learning about family history, but also their pregnancy history. Also symptoms they could be having during menopause, as we know that the menopause transition is a critical time of cardiometabolic change. And it's a really nice window to really make an impact in the women's life. And as we change a woman's life and their lifestyle habits, we've seen in studies before that it eventually can change the way a household also functions. So it also can change the dietary patterns in the family and the lifestyle patterns there as well.
So I would like to start on that point when you mentioned menopause, and I think that is one of the topics that general public seems to underestimate the impact of menopause on as a risk factor for women's heart health. What are your thoughts about the effect of menopause as a risk factor?
Look, menopause is something that women naturally go through, and I'm not even sure if it should be labeled exactly as a risk factor, but it is a transition time where the risk of cardiovascular disease increases because of the lack of estrogen and because of the biological changes that happen at that time.